If you're over 50 and taking Amlodipine, Losartan, or Lisinopril every day, this message could be one of the most important health discussions you hear this year. Before you panic, let me be absolutely clear. Never stop taking your medication without speaking to your healthcare provider. These medicines have helped millions of people control high blood pressure and reduce the risk of heart attacks, strokes, kidney disease, and heart failure. But what many people aren't told is that after age 50, your body changes, your kidneys work differently, your metabolism slows, and the way your body responds to medication may not be the same as it was 10 or 20 years ago. Many people assume that once they start a blood pressure pill, nothing else matters. They continue eating the same foods, taking over-the-counter medications without checking for interactions, and ignoring small warning signs because they believe the prescription is doing all the work. Unfortunately, that's where problems can begin. Let's start with Amlodipine. This medication belongs to a group called calcium channel blockers and works by relaxing blood vessels so blood flows more easily. It's highly effective, but one of the most common side effects is swelling of the feet and ankles. Many people think this swelling is simply due to aging or standing too long, but it may actually be related to the medication. If the swelling becomes severe, painful, or is accompanied by shortness of breath, it deserves medical attention. Some people also notice headaches, flushing, dizziness, or fatigue when they first begin taking it. These symptoms often improve over time, but they shouldn't be ignored if they persist. Now let's talk about Losartan. This medication belongs to a group called angiotensin receptor blockers, or ARBs. Losartan is often prescribed because it not only lowers blood pressure but can also protect the kidneys, especially in people with diabetes. However, Losartan can increase potassium levels in the blood. That may sound harmless, but dangerously high potassium can interfere with the electrical signals that control your heartbeat. Many people over 50 take potassium supplements, salt substitutes, or multivitamins without realizing they may already be getting enough potassium from their medication. Combining these without medical advice may increase the risk of abnormal heart rhythms. That's why routine blood tests are so important. Now let's discuss Lisinopril, one of the most commonly prescribed ACE inhibitors in the world. It is extremely effective at lowering blood pressure and protecting the heart, especially after a heart attack. But one side effect surprises many patients: a dry, persistent cough that doesn't seem to go away. Some people spend months thinking they have allergies, asthma, or a lingering infection when the real cause is the medication itself. Another rare but serious side effect is swelling of the lips, face, tongue, or throat, known as angioedema. Although uncommon, it can become a medical emergency because it may interfere with breathing. If that ever happens, immediate emergency care is essential. Here's something even more important that many people never hear. Blood pressure medication is only one part of protecting your heart. If you're taking these medicines but continue eating excessive salt, processed foods, sugary drinks, smoking, avoiding exercise, or sleeping poorly, you're asking your medication to fight an uphill battle. Healthy lifestyle habits often allow medications to work more effectively and may even reduce the need for higher doses over time under your doctor's supervision. Another hidden issue after age 50 is dehydration. As we age, our sense of thirst naturally decreases. Many people simply don't drink enough water. During hot weather, illness, vomiting, diarrhea, or heavy sweating, dehydration can cause blood pressure to drop too low while taking medication. This may result in dizziness, fainting, confusion, or dangerous falls. If you suddenly feel lightheaded when standing up, don't ignore it. Speak with your healthcare provider because your medication dose may need adjustment. Kidney health is another critical factor. High blood pressure itself can damage the kidneys, but kidney function also affects how medications are processed. That's why doctors often recommend periodic blood tests to monitor kidney function and electrolyte levels. Skipping follow-up appointments because you feel fine may allow silent problems to develop unnoticed. Many people also don't realize that common pain relievers like ibuprofen or naproxen can reduce the effectiveness of blood pressure medications and place additional stress on the kidneys, especially when used regularly. Even some cold medicines and decongestants can raise blood pressure significantly. Before starting any new medication, vitamin, herbal supplement, or over-the-counter remedy, it's wise to check with your doctor or pharmacist. Another important point is home blood pressure monitoring. Too many people only know their blood pressure when visiting the doctor's office. But stress, anxiety, and daily activities can cause readings to fluctuate. Using a reliable home blood pressure monitor and keeping a record of your readings can help your healthcare provider make better treatment decisions. Don't obsess over every single number. Instead, look for patterns over time. Also remember that low blood pressure isn't always better. If your blood pressure drops too low, especially in older adults, it can increase the risk of falls, dizziness, and reduced blood flow to vital organs. Medication doses should always be individualized based on your overall health, age, kidney function, and other medical conditions. Finally, never compare your prescription to someone else's. Your neighbor may take Losartan while you take Lisinopril, and another friend may be prescribed Amlodipine. That doesn't mean one medication is universally better than another. Each works differently, and your doctor chooses the medication based on your unique medical history, heart health, kidney function, diabetes status, and other individual factors. The biggest message today is this: don't fear your medication, understand it. Ask questions. Keep your follow-up appointments. Monitor your blood pressure at home. Maintain a heart-healthy lifestyle. Report new symptoms promptly, and most importantly, never stop taking your prescribed medication without professional medical advice. These medicines save lives every day when used correctly, but knowing what to watch for after age 50 can help you stay safer, healthier, and more informed. If you found this information helpful, subscribe to Dr. Jhon A. Demaria, because every week we share practical, evidence-based health advice designed to help you protect your heart, improve your health, and enjoy a longer, healthier life.